Portland Emergency Department is the front door to the whole state's emergency system. I think in the past maybe you went to a hospital and you would try and get all of your one things at the same hospital. But I think Portland, if you come to Portland with an emergency, more than 9 out of 10 people will be able to be treated locally and either admitted locally or sent home. But if you need to get some specialty service in Geelong or Warrnambool or Melbourne, then we're very happy to arrange that. In fact, we're very good at arranging that.
My name is Anil Xavier. I'm one of the physicians in the hospital. I'm a medical physician, so I get called to ED when there are sick patients that require a senior person's input. So the emergency department is staffed by a medical doctor 24 hours a day, 7 days a week, and they usually assess and they manage them initially. If they have concerns, they're not able to manage them because they're quite complex or they need a specialist input, then they give me a call and I come in to assess them.
I'm the unit manager of the department, which manages the nursing staff, the running of the department, the day-to-day workings, organising education or liaising with the education department as far as getting education for the staff, liaising with the doctors, the GP clinics, the administration of the hospital. All our staff are very dynamic, professional, keen. They have gone off and all have the advanced life support. That's mandatory to work in the emergency department. They have trauma training. Most of them have done their trauma nursing certificate. They have all gone off and done other little areas, training in their own field. They're really keen to stay professional, stay updated, attend conferences, attend study days. We have some staff who take on special portfolios themselves, so they'll specialise in a certain area to pass that information through to the other staff. So they are fantastic, really good groups, team that work really well together.
We have a telemedicine link with the retrieval services in Melbourne, which means that if we have a patient who is critically unwell, we can press a button on the wall and we can have an immediate video link with the retrieval services, so they can look into our resuscitation room, they can speak to the patient, they can speak to the staff, they can see everything that's going on. The people at in the Melbourne end can control the camera at our end and they can focus in if they want to have a look at the patient's eye or ear or their ECG or their monitor. So that makes it really very easy for critical care patients.
We now have a room with capabilities of 4 patients can go into that room. It's designed to give patients a little bit more comfort. You know, every now and then patients might need to stay for observation from, say, following a knock to the head, or they've had some chest pain and we want to monitor and make sure we're not sending them home too soon. They're monitored closely, they're watched by nursing staff. It's like they've been admitted to the ward without actually having to be admitted, and it's just been a great flow for patients in the emergency department. As I said, it stops them having to have that long wait on an emergency trolley. Helipad is just sensational, you know, it's made it so much easier for our patients, for our staff. With the helipad, they'll be able to be transferred straight out of the emergency department straight into the chopper, which is just time-saving, precious hours, precious minutes actually that are needed. We're really lucky to have it, and it's great.
There are quite a few senior trained nurses in ED. They've been here for a number of years with also sort of experience in sort of high dependency, intensive care and other bigger emergency departments in the past. So they're well trained and they can recognise and they can also give us advice as well as to how to manage some of the sick patients that come into the department.
I am very proud as a nurse unit manager to have the team that I have of highly qualified nurses that anybody would be confident to come in and be treated by these staff. We have a mix of male and female, varying ages with a lot of experience that they can bring to the department. So yeah, very proud of my team.
I think we've got all the things that we need to do our job in Portland. I think we're a small emergency department, but we treat a lot of people who are really very unwell, and I think we do that very well.